Hey folks, Scott Weingart here, and this is another disembodied head procedural video.
So I figured what I'd do is show you the actual procedure first and then talk about it a little bit. So here's Rory with a ultrasound identifying a vein. He sees a nice big plump vein. He's injecting local anesthetic from the kit. He's not going to blow his whole wad here. He's going to use about half the syringe for the skin anesthesia. We'll talk in a little bit why you want to save about half of that syringe, because you're going to need to anesthetize a different spot later on. There's that big fat vessel. All right, he's now poking with the non-safety needle. He gets his flash, disconnects the syringe, takes the beautiful floppy wire, advancing it into the vein. And you can see it goes super easy, telling you have a nice patent vein. We feel good about this. You don't have to put it all in. You really just need enough so that you're about halfway down the wire. He's making a nick over the wire now, and he's going to insert the dilator. Now, the dilator is big and thick, so you really want to make sure it goes easy. And if you're reaching resistance, then rack the wire in and out to make sure it's not still kinked. And when you're actually pushing on the dilator, push right near the skin. Don't push far away by that little T-piece. You want to be a couple centimeters away. He's removing the interstylet. You saw that rush of blood. He puts his thumb over it to prevent the patient from exsanguinating. And now he's going to take the pre-stiffened midline. I'll explain what all that means. He's going to gently insert it into the breakaway dilator. He's going to advance it up. And sometimes there's a little bit of friction here, but if you meet any real resistance, don't push. Come on out and try again. All right, here he goes. He's just clearing out his little wire guide there. All right, he's putting it in. You don't want to put it in all the way to the hub yet, because you're going to need to break off that dilator. You'll see what that means in just a sec. All right, that looks like a good amount, but Rory wants one push more. Okay, there we go. That's the right amount to have out, about 3-4 inches. You'll pull back on the dilator and then just crack it, and it'll split in half. And then you're going to pull it down till you're near the skin, but not at the skin. You don't want this breaking apart inside the skin. You keep pulling it out over the midline itself. Pull it out, break. Pull it out, and break. And we lost the last little pull, but you'll see it in a sec. There it is. Okay, final break is done. Now you could hub the midline.
Today we're going to talk about the MedComp Midline set. And this is a very good set. We are happy with this. And this allows you to do CT power contrast studies, as well as at our hospital, administer vasopressors. So it's a good substitute for a central line. And it's a good substitute for patients you can't get peripheral access for and you want to do a CT scan. You could, for that case, use the shorter midlines, but we are not so happy with those. So I'm going to take you through the kit. It's a pretty extensive set of steps, none of which are hard, but you got to get them in the right order and do them properly. So let's open this bad boy up. You would have, of course, already consented the patient, put them in proper position, brought an ultrasound machine to the bedside. You got your little instruction pack here. You don't need any of this for the procedure while you're doing it. You need it afterwards, so we'll put that aside. Okay, let's open this bad boy up. So right up top, you got your hat. You got a set of sterile gloves, and you have a tourniquet and a tape measure. You also have a mask for your assistant, because they should be wearing a mask throughout this procedure as well, because it's full sterile. So you could pop on, this is a non-sterile tourniquet. It was sterile when it came out, but the point is you could use it non-sterilely. You could pop this on the arm. You could use your ultrasound to actually find which vein you want to use. And then you could measure from that vessel to your actual site you want to have the tip end up at. Now for us, we were doing it right to the crease of the arm, and we had some situations where in the last couple of sonometers, it wouldn't quite advance. And so now we've taken to just going like 2 centimeters below the crease of the arm, and we've had better success with that. So we always measure with the sonometer side of the ruler from the insertion site to that point, couple centimeters from the arm crease, and we've had good luck with that. So find out what that number is after you pick the site you're going to cannulate. All right, let's open up the sterile portion. All right, here is your gown. This is a full gowned hat, mask, sterile glove procedure. You have another set of sterile gloves in here, so you get full sterile. I'm not going to do that for the purpose of this video. You have a very nice drape, which, while not full body, is covering up all of the surfaces you care about for this procedure. And this is a non-fenestrated drape. So what you're going to do is use this to cover up everything except the actual site. You have your set of needles. We're going to put this aside for now. We're going to use that later. You have your ChloraPrep stick, and I would have already prepped the patient prior to this point. I don't like being prepping when already full sterile. I have a tendency to lose sterility at that point, but they're there for you. There's 2 of them. Yet another mask, I guess, if you have another observer who shows up, I don't know. You have this kind of towel, I guess if you wash your hands. And then you have the actual fenestrated drape you're going to put on the site. We're going to save that. You have additional drape if you have to cover up more of the arm that's not covered. Ultrasound probe cover. 2 flushes. You'll see those in a sec. You can label your flushes and your lidocaine. We'll put that aside. And 4x4s and some tape. There is then a procedural checklist if you wanted to hand this off to your assistant and let them check off the steps of, confirming the patient, site, prep, was the wire out, blah, blah, blah. You know the deal. Okay. Now, steri strips for eventual securing. A cautionary note. We'll talk about what that cautionary note says. Another tape measure in case your site changed slightly and you want it to remeasure. A tegaderm. A stat lock. We'll talk about that. And now this is the actual procedural portion of the set. And we're going to go through these one by one. So there's a lot of prep work that goes into this kit. What you want to do first is prepare your catheter. And that's a little bit more complex than you may be used to dealing with regular central lines and such. So I'm going to take you through it step by step. This is a 20 sonometer midline, but that may be too long for some patients. You've already taken your measurements for how deep you actually want to go. So here's the deal. What we're going to do is inside this is this stiffening wire, and that makes it easier to pass, but you don't want to cut that stiffening wire. So what you're going to do is look at the sonometer marks. Let's say you measured at 17 as the length of the midline you actually want. I take this wire out entirely. I don't know if the camera will pick that up, but the wire's now out of this midline. And I'm going to take the scissors that are in the kit and cut it at 17. And now I know the wire is not there. You cannot cut the wire. So the markings on the side, it goes 20, 19, 18, 19, 18, 17. So I'm going to cut right at 17. You just cut it straight across. Okay, so now I have a 17 sonometer midline. Now I'm going to put the stiffening wire back in. And now I'm not sure if you need to put the stiffening wire back in, but we've always done it with the stiffening wire. It's been easy. It's gone super smooth. So I'm sticking with that. So what I'm going to do is I'm going to put that wire back in. And then this little side adapter thingy just lure locks around this port. And push the wire in all the way to the hub, and it'll actually pop out the tip. Now you want to pull it back so that it's at least a 1/4 inch back from the tip of the midline. You do not want it protruding. And then this little blue dial here locks it in so that it can't move back and forth and it can't protrude out of the vessel. And what I like to do is I like to pull it, make sure it's tight, and then actually bend it. And if you bend it, there's no way it's going to advance forward. So now it's kind of kinked back here, and it's definitively locked on this blue bad boy. All right, the next thing to do is flush the midline because you don't want air in there because there's no wire blocking that air. Plus, this gives you the opportunity to actually push and pull saline if you think there's a clot at the tip and you're not getting good return. So the one with the wire in it gets flushed out of the side port right here. So I'm going to just flush that bad boy. There we go. And then lock the side port. And then the one just gets directly flushed. And I'll lock that one too. And you could actually, if you want on the red one, put on the blue cap right now after flushing that. All right, so there we go. This is our midline set up, ready to go. This is the wire. It is a very thin wire, as is most of the stuff you're going to deal with. Super floppy so that you can't really puncture through those delicate vessels. This does make it kind of hard to align into the veins, but it does make it safer. So this little blue cheater may or may not get in your way. It does center it in the vessel, but it does make this whole thing a little bit awkward. You could figure out which way you like to use it. We'll show you that. And the other parts of the kit, this is your dilator assembly. This is what's going to allow you to actually transition from the wire to something the midline will fit in. I'll show you how to use that in a sec. You have your scalpel. And then you got some lidocaine in here. It's very nicely covered with a gauze so you can't cut yourself. Let's crack that bad boy. And then there's this long tubing that you could use to draw it up without having to stick a needle in there. So let's grab our lidocaine up. And that's nice. We got our lido. All right, there's a little anesthesia needle in there. And if you want it to be cool, you can actually put a lidocaine label on it, which I think is kind of neat. There you go. You got your labeled lidocaine. Okay, so now we're pretty much ready to go. I'm going to take you through the procedure with this kind of box here in lieu of the arm, and we'll drape it, make it look good. Do it. So, you got choice of two needles. They're both essentially the same. One is non-safety and one is safety. This is the safety one, which I don't use. I prefer to not have the added bulk and such. But the safety one, once you have the wire through it, you could actually turn and pull, and now it's permanently locked. This is just your standard non-safety needle. They do have an echogonic collar, so they show up nicely on ultrasound. And I think they're built not to have a syringe attached. Most people probably won't. If you want to use a syringe, then just take the extra saline flush, empty it out into your kit, and attach that. And now you have your needle syringe assembly. But if you're using ultrasound, you might want to go without a syringe because then you'll actually see the flash. So you take your ultrasound probe, pop it on there, find your vessel, and now I got blood coming out of my needle. I'll hold my needle so it can't move. I'm going to now take my wire and advance the wire. And it doesn't have to be super far in, but if it goes in easily, you know you're going to be easily able to advance the catheter. So you can advance it up. And here's the back end. You don't want to use this back end. It is not floppy, unlike the central line wires, which you use both ends. All right, so now I have a wire in the vessel. I can take my needle out and pop it into the nice little integrated sharps container. Now, here is the point where we don't have a clear, easy answer to what you need to do next, and maybe the PIC nurses will help us out, but you need to release your tourniquet. And what we've been doing is just asking an assistant in the room to slip under the drape and pop the tourniquet. But you're not going to be able to do that the rest of this with the tourniquet on, and yet it's not easy because it's underneath the drapes. And what we, when doing it alone, have been doing is just reaching with the drape itself and pulling the tourniquet, which is doable, but you got to find both ends. It's kind of annoying. I've seen the PIC nurses at other hospitals have tourniquets that you just push a button and it pops open, and that's obviously the easier way to go. For now, this is a problem still looking for a solution. But now you have a vessel with a wire in it. The tourniquet is off. And what you're going to do now is you're going to put the dilator on the wire, advance it to the skin, making sure it pops out of the back. And now when this blue portion is actually in the skin, you want to really grip it close to the skin itself. Hold the wire with your non-dominant hand, and like a sonometer or two away from the skin, gently advance, regrip, advance, regrip, advance. And you want to be parallel to the vessel itself, so you're not backwalling it, until you're all the way at the skin. And now, if you take the wire out, you're going to turn counterclockwise, half turn, quarter turn actually, and take out this dilator portion. So now the wire and the dilator portion of this sheath are out. And now what you have essentially is a big sheath in the vessel. This part is painful, this dilation step. So in general, I would have anesthetized the site before sticking with the needle. And before doing this dilation, actually right at the skin over the wire, give a nice, 2 cc's of lido into all that skin directly at the point you want to dilate, and that's going to make it more comfortable. So now you have a sheath sticking out. I'll keep my finger over it so that I'm not bleeding everywhere. And now I'm going to take my midline and just insert it into the dilator. And it should go gently and easily. Again, I'm just doing the advancement right at the skin surface. And now I'm not going to push it all the way in yet, because at this point, what I want to do is I want to pull back a little bit on my dilator so that it's out of the skin, maybe like 2 centimeters. And now I'm going to break the dilator. It just breaks in half. And I'm going to spread the dilator with the portion I'm spreading out of the skin. And then pull more of the dilator out, spread, pull more of the dilator out, spread, pull more of the dilator out. And this way, I'm not breaking the dilator inside the patient's body. I'm breaking the dilator out of their body. And then advance and spread until the dilator is all the way out and broken. Get rid of that. And then I'll advance the last portion of the midline in so that it's hubbing at the skin. Okay, what now? Next, I'm going to take out the entire side portion with that wire in it in one motion. So I'm going to unscrew it and then take out the wire and the side portion. And I could clamp this for now. And now I'm going to take my second syringe right here. I'm going to put on that last cap. And I'm going to make sure I get blood back, blood right here, flush. I'll go to the other blue cap, unclamp, pull back blood into this one, flush. And now I've made sure both of the ports are getting good blood return, and that tells me I'm in the right place. All right, now securing. First thing I do is I grab a whole bunch of 4x4s, get rid of all the blood, make this site nice and clean. I'll take a second ChloraPrep stick, wipe the entire site. Blood is a nidus for infection. Get rid of all that blood. Okay, now dry the site again. Make sure now all nice and clean. I'm going to open up this StatLock package. There's a couple things in here. You have the StatLock itself. You have some additional securing tape. You have instructions, which you can read at your leisure. And then you have a skin protectant pad. So I'm going to take the skin protectant pad, go underneath the hub of the midline, Let that dry. And now you take the stat lock, and I actually like to lock it around the hub of the midline first before putting it on the skin, because it's easier to do this in the air, and just lock it around the hub. All right, now the hub is locked into this bad boy. And then what you could do is pick out your skin landing site and just spread these two little pulls. And that skin prep makes this super sticky. And now it's secured, and that's it. And now the secondary securement, you can put wherever you like. I generally will put it right here, right behind that stat lock. And that gives some tension release. Now, what this set doesn't have that we need at our hospital is a bio patch. So you have to get those separately. It's kind of annoying, but that's what we're dealing with. So pop a bio patch on there, and then take your teggy out the whole thing, including the bio patch. Don't get your little purple clamps in there. And if you're really good, you'll take out the little date portion. And you could time and date that bad boy. And there you go. Now, you don't need an x-ray. You do need a procedure note. And on that procedure note, make sure you note where you cut the midline so that when people pull it, they know that the entire catheter has come out appropriately. And there you go. That's midline placement. Let's see it for real.
All right, so Rory's injecting again with half of the lidocaine syringe. We're saving the other half for later when we actually do the dilation. There's the ultrasound. All right, here comes our nice big introducer needle. Looking on the ultrasound, and there it is. Nice flash. And there it's still going. We know we're patent in the middle of the vessel, so we'll put that floppy wire in. Advance about halfway of the wire. Going nice and smooth and easy. Great. Needle comes out. Tourniquet goes down. We didn't show that part, but you'll take down the tourniquet now. Little nick right over the wire. Be careful. The vessel usually is pretty close to where the wire is on these midlines. Here comes the dilator. And again, I'd give the other half of the lidocaine here right above that wire where we're going to push against the skin with that dilator. He's holding the wire right close to the skin, pushing the dilator in, pushing it in, pushing it in. Went nice and smooth. No interruption that would make you think you're kinking. Otherwise, you could rack the wire back and forth. Out comes the dilator. Cover the hole. Here comes the midline. It's already been stiffened, and the wire has been made sure not to protrude from the tip. Midline's getting advanced. Not all the way. We'll leave out a few sonometers so we can break our dilator. There it goes. In. Yep, nice and smooth. Okay, pull the dilator out. Don't break it inside the skin. Break it outside along the actual midline itself. Break. Not to the skin. There we go. We stop. We pull back. And break. Pull back. And this will be the final pull. It's now fully split. We can advance the midline to the hub. We're going to check both ports. There's some nice blood. And it had already been pre-flushed. We're just checking each patency of the lumen. And there you go. So if you have any questions, just put some comments on this post itself, and we'll see them, and we'll get back to you.